Okay, Matthew Holt with THCB and the THCB Spotlight, and I'm here with one of my favorite companies in the mental health slash substance abuse space, and one of my favorite CEOs with one of my new team members. Okay, this is Stephanie Strong, CEO of Boulder, and Marianna Zaslavsky. I hope I didn't murder your last name, Marianna, too much, or your first name, who has just joined Boulder. So let's catch up. Stephanie, there are people watching this who don't know what the hell Boulder is, what it does, what's wrong with substance abuse in the first place, and how you're dealing with it. So go on, tell us where Boulder is, and let's quickly catch up on what you've been doing.
It's great to see you, Matthew. Thank you for having us. I'm Stephanie Strong, the founder and CEO of Boulder Care. And Boulder is a provider of high quality addiction medicine over telehealth, treating people with opioid and alcohol use disorders and co occurring conditions. We've seen over 30,000 patients now, and with outcomes more than 3 times better than the national average. We're really proud of these extraordinary outcomes, particularly for the people we treat who tend to be low income, struggling with a lot of social needs, and covered by Medicaid, which I think we'll talk a lot about today. So thrilled to be here and share some updates in the company. And an update we're incredibly excited about is welcoming Mariana to our team in the last 90 days.
Brilliant. So just before we get to Mariana, just remind people a lot of this has to do with prescribing of medications to combat opioid use disorder. So tell us a little bit about that and tell us a little bit about what you personally and Boulder did about that issue regarding prescriptions of those medications over telehealth in recent months and years.
Can share that prescribing medications and helping people get access to evidence-based treatments is core to what we do. Medications cut the risk of overdose by half or more. They help people regain their quality of life and are very significantly underutilized. A lot of difficulties in prescribing medications, lack of access to specialty providers nationwide, particularly in rural areas, and a lot of stigma and misperceptions about using medication to treat addiction and the long-term chronic nature of this disease. So for years, Boulder has not only been making access to these medicines more accessible and evidence-based, we've also been doing a lot of advocacy and education so that we can bring the rest of the industry along to the best science for people who need care. And that includes changing policies as well. So we advocated fiercely for patients beginning in 2023, when after COVID, there has been a lot of back and forth from regulators about telehealth and a permanent framework for making medications available. When we learned during COVID that not only is telemedicine safe and effective, in many ways, it's actually better than the status quo for people who have struggled to get access and stay in treatment. And so working to change policies to align with the modern science and what we know about this condition, making telehealth a permanent part of how people are getting this care, and now advocating for changes on the horizon in Medicaid to make sure that people with substance use continue to get access, whether in person or through telehealth, without disruption to their benefits.
Fantastic, and I think that was an excellent. You spearheaded what I think was just a common sense excellent campaign when the DEA was suggesting that telehealth and other it was really hard to describe those substances. Somehow lumping the stuff that helps people in with the stuff that hurts people is not great. But we know that, and this is prior to the Trump administration, so we can't blame it all on them. all right. Mariana, so you've been in a number of digital health companies, and now including recently in groups, right, which is a different flavor of mental health. Tell us a little bit about your background, a bit about what you've been doing, and a little bit about why did you come join Stephanie?
Yeah, so happy to be here. I heard a lot about you, and I'm very honored to have this conversation. So I am currently leading our commercial strategy and our growth partnerships at Boulder. So that includes value-based contracting, new market expansion, and payer success. I've been doing a lot of this kind of work for a long time, as you recognized, Matt, with about 6 years focused specifically on managed care and Medicaid. So as you correctly noted, most recently I led value-based market growth at Groups Recover Together. I launched a number of new geographies there, all under value-based arrangements. So I really do love working with payer partners, figuring out complex sort of contract structures and agreements to align our incentives. And outpatient SUD care is still highly, highly underutilized. So that's why I continue to invest myself and my time into this space. But specifically, I joined Boulder because there's just so many wonderful things and so many unique things about Boulder. But specifically, patient first, harm reduction philosophy is just an absolute must, in my opinion, in this space. But also the ability to deliver same day access to medication, measurable cost of care outcomes, and a truly comprehensive clinical model. It's just rare, in my opinion, to find that depth of care and performance in one place. So I'm really excited to be here.
Fabulous. So the obvious question is, Stephanie's been doing a wonderful job. Boulder's been growing. What? It's not quite why do they need you, but where are the opportunities that you think that you can take Boulder to, or that you and the rest of the team can take Boulder to, that have not, that are coming up? Is this to do with the change in Medicaid? Is it to do with getting more access to value? What do you look at and say, okay, here are the things where we can really move the needle for patients in these areas?
Value-based care is still highly underutilized, I think, in general, and no one would disagree with that, but specifically within behavioral health, and then even more specifically within the world of substance use disorder treatment. And that's really my area of specialty. And so I think there's just so much for us to do there and deepen our partnerships with our payer partners by using value-based arrangements as a mechanism to do that. That to me creates a virtuous cycle, because if you can go deeper with your payer partners as a provider and you can really become a strategic tool in their toolkit, you can help those payer partners become even more valuable to their state partners. And then all the work that we're doing on the ground in working with our state agency partners, all the way down to local community organizations, all of that becomes a one big feedback loop where you are focused from multiple directions on improving the lives of our communities and the people who are struggling with SUD. So for me, that's my shining light. That's why I wake up every morning. That's why I love value-based care and I love the application of it in this space. And I think in general, we all have a lot more room to grow there. And so I'll speak for, the Boulder perspective there. We also have a lot more room to grow there in deepening our partnerships with our payer partners and getting more sophisticated, but then also entering new states in that value-based paradigm and saying from day one, how do we become a strategic partner and how do we deliver value at that level from day one when we enter a new market? So that's the bulk of my work right now at Boulder.
Fantastic. Well, I know which one you want to take this. Stephanie, remind me where you are in the state of play of how many states you have now, how many patients under or potential covered lives or patients, however you measure your activity. How's that grown over the last few years? And then let's sort of flip this, and maybe you could both answer this, or one you could take one part, one take the other. What is the sort of state of mind of states, but also the managed care plans who are basically delivering the Medicaid services that we're talking about in terms of this kind of new approach? So where are you, and how do you think the clients are going to take it is basically the question.
Yeah, I'll take part one and then let Marianna talk about where health plans are. And it's been incredible over the last few years, the growth year after year in kind of geography and in our patient base. We're now in 5 states and very deep in those states. Marianna referenced community partners. We work closely with healthcare providers to make sure that we can offer continuity and bring people from hospitals, emergency departments, or the justice system into care very quickly, which is such a benefit of telehealth. And we also really look to connect culturally with local peers who are part of our team and understand what people are going through in that place at that time in that language. And then the collaboration that happens at the national level. What are you seeing in your drug supply? Well, we dealt with, fentanyl and kratom over here, and this is what we've seen and how that might evolve. And a lot of education and community on our provider workforce as well. So that's been a really special part of the trajectory. And we've more than doubled our patient base every year. And more than doubled our number of health plan partners under value-based arrangements as well, just in the last couple of quarters. So growing quickly, and as we have these deep partnerships with some of the plans that really dominate the national landscape and are pulling us into new states, asking us what more we can do, And most recently asking, how will you be the strategic partner that will help us weather the storms that are coming in the broader macro landscape? It's such an amazing time to welcome Marianna. She mentioned that we're relatively new as a country to value-based contracting, particularly in behavioral health and in Medicaid. So to find someone like Marianna, who's been doing this for many years and has a perspective to marry with ours and a real strategy and trusted relationships with plan partners, is kind of a match made in heaven from our perspective. But I'll let Marianna share a bit more about what she's learned and continues to learn and spending time with plans, and where we can go next as we look ahead.
Yeah, so something that as I was doing my own diligence in considering joining Boulder, I spoke to a number of payer partners and I said, "What do you think of Boulder?" And I heard only great things, which is part of the reason why I came over. But I will say now that I've been in the role for 90 days and I have met with all of our payer partners, I continue to hear great things, which I think is incredibly validating. So to start off there, Matt, to answer your second question, there is more room for us to grow and to deepen and do all the things that I said that I want to do with our payer partners, despite some of the headwinds that are happening in Medicaid. And I think a couple of sort of like grounding principles there, or sort of why, in my opinion, there is going to be a continued need to serve members with SUD under Medicaid. And that's where most of the lives are today. And so it is what it is. So it is a population that's going to continue to necessitate thoughtfulness, consideration, and investment from our MCO partners, but also the states, right? The state partners and their state regulators. So it becomes this very kind of unique and interesting population where there's so much opportunity and so much attention from multiple perspectives. It doesn't just become like, oh, is this the most expensive line item and how do we use value-based care to decrease the cost? Like, yes, that's an element. But there's also, because of the impact ultimately this disease has on communities, state costs, recidivism, the justice system, work, right? Getting people back into work and the labor supply. There is, in my opinion, so much opportunity for us as a provider, our MCO partners, our states, so on and so forth, to continue investing in this population, in this space. So I'm very bullish on this space overall, that to say one thing. I think the other thing that makes it really sort of great to do my job at Boulder with our Medicaid partners is, in particular, with some of the headwinds that are coming for all of us who operate in the Medicaid space, to be able to work for an organization that is highly scalable, going to be available in the markets that we're in today and in new markets, no matter what those headwinds are, no matter what those local supply disruptions might be within that particular market. That's what makes Boulder so unique, is its ability to provide access not only throughout that state, but again, go into new markets with a great deal of efficiency. And then I think the other thing that's really interesting about where Boulder's role in the coming future here, again, is specifically thinking about where Medicaid might be heading. We've had a model that supports wraparound care and invests in wraparound care since day one. That means work requirements are a part of and eligibility and helping our members get back on their feet, not just on work, but in all aspects of life, is core to what we do. So I think that's going to become a key component of our success, not only with our members, but with our MCO partners, because that's not a job they can do alone. They're going to need providers and community stakeholders to help them with that. And then the last couple of points there is, I think, value-based care, what's really kind of great about it in this world of budget cuts and tightening is that it does provide line of sight and budget stabilization for the SUD population. The more folks that are in our care, the more line of sight that MCOs have to the costs of this population, but also the clinical outcomes of this population. We retain folks at a 2 to 3 time rate than the rest of the industry. We know that the utilization of high cost settings like the ED, inpatient, residential, just trend downwards almost immediately after the first couple of months. So it's budgetary stabilization, line of sight, and lower admin costs, candidly, because we're not fee for service, we're not churning, we're not submitting thousands and thousands of claims. So I think it's a really great place to be for us as an organization, and obviously for me personally. I continue to believe in this space and this work.
So it makes sense for the managed care organizations doing this. Let's scratch the thing that we've all been dancing around, which is, with the Big Beautiful Bill Act, whatever the hell it's called. We're going to see, obviously states both losing federal funds and losing matching funds, and also cutting their own roles in Medicaid. There will be work requirements. There will be a bunch of other things going on. What do you think the impact on the population that you're serving is? People with SUD who've been, at the forefront. You mentioned many of them have obviously, if you like, marginal, hold on things like housing and work and all the rest of it. What do you think is going to happen to those people, and what's going to happen to Boulder?
Steph, do you want me to take that one? I'm happy to, but if you want to jump in, feel free.
You want to start? That'd be great.
Yeah. I think, going back to another piece that drew me to Boulder is while certainly we serve mostly Medicaid folks, we do serve all lines of business, and that's intentional. We do contract across all lines of business. We are also grant funded in many of our states. We also have self-pay programs. That's all to say that we are prepared to serve this population, no matter sort of like where they might go in terms of their insurance coverage. And I think that's a really, really critical piece there. Will there be enrollment churn? Of course, right? I think that we saw that during redetermination, and I think I'll let Stephanie speak to that period of time, but I can tell you in my experience, we work through it. We find the way to meet this population where they are with the type of insurance that they have. And so I believe that that'll be the case for us going forward. But maybe Steph, maybe you can pick up on some perspectives there and then some additional thoughts that you might have.
That's exactly right. Startups are resilient, especially those like Boulder built for Medicaid during the last several years where there hasn't been a year that hasn't brought unexpected macro changes. Our patients are even more resilient. The resourcefulness, ingenuity. I mean, we have folks who are without phones except for an hour a day, and that's when they come to their visit every time, and they've done that for 3 years with 5 kids and 2 jobs. And it kills me to hear some of the talking points in the media about, patients, people on Medicaid sitting on their parents' couch playing video games when we're trying to impose work requirements on the hardest working people you can imagine. And so they will continue getting their substance use treatment through Boulder, and we will continue finding ways to solve their problems, whether that's more flexible hours so they can take visits in early mornings and evenings around their other responsibilities, whether that's offering better tools and support for eligibility, as we did during Medicaid redetermination when health plans leaned on us to communicate changes to their members because we're talking with them daily. And that's always been a real challenge for plans. Or perhaps some of the work we're doing in advocacy to help make sure that SUD is carved out of some of these provisions and won't be as affected by the bill, because we know, as Marianna said, it's such a high priority for so many states, including very deep red states and communities where we've seen this problem be one of the top political issues. So there's a lot to do, but we're committed in doubling down to serve this population. And in many ways, I think this is just an acceleration of the trends that we were built for. We've known for some time that Medicaid is a place that needs innovation. It needs technology to help with efficiency and cost savings that can be linked to real outcomes. Addiction medicine, in the same ways, needs reform, and that's why Boulder exists. There are providers that are not actually resulting in great outcomes, and people are cycling through detox facilities and residential and inpatient stays that are unnecessary and expensive and poor experiences for our patients. So accelerating value-based care, accelerating the accountability that addiction providers like Boulder experience with plans in order to get reimbursed for outcomes, those are trends we can be really excited about. And I wish that it wasn't happening in a way that was so sort of linked to old paradigms like work requirements, things we know don't work and actually raise costs. So we'll try to be a driving force in the industry change, bringing down costs, improving outcomes and quality, being more efficient with our precious resources, but in new ways that technology and evidence can support rather than the things that we've tried 10, 20, 30 years at a time.
So on that note, because you wouldn't be here if you weren't starting another campaign. Tell me about the campaign that you're now in leadership of again, which is called Majorities for Medicaid. What are you doing? What are you hoping to do? And how can we all get involved?
Yes, the Majority for Medicaid campaign is a grassroots and advocacy campaign. We've been spearheading with over 40 other digital health organizations that are focused in serving Medicaid beneficiaries across multiple specialties, from women's health and primary care to youth and substance use disorder like Boulder. We've all been working in this space and see opportunities for innovation and change that accomplish a lot of the national goals, but in a way that takes care of patients and recognizes the profound importance of investing in people's health for the economy, for our workforce, for the future generations of people who are supported by Medicaid. And we're sharing these stories from our patients, from our staff, and others in industry who are participating to help just talk about the benefits of Medicaid and raise awareness. We actually know that a lot of Americans who are covered by Medicaid don't even realize that that's their plan, as we're hearing so much in the headlines about cuts and changes. So we want to empower voters with the understanding that this affects their lives. And over the next couple of years, there will be some major changes that they can help stop by reaching out to their elected officials. Similarly, we know that 50% of the electorate is affected, whether through their own coverage or a loved one. This is a really important issue, so awareness is key, and that the majority of Americans support Medicaid and think it's a really vital program to continue funding. So we're bringing together voices from really all walks of life, all political parties, to put forth ideas and solutions that don't involve blanket cuts and can help us get to more efficiency without losing coverage for people who need care most.
Sounds great. How do people get involved? How do they find out more about what you're actually doing? Where are these stories being shared? Sorry.
Yep. So using the hashtag Majority for Medicaid, you can see some of the stories just in the last couple of weeks shared from over 10 organizations as well as ours, people who rely on Medicaid and have now, over the course of multiple years, seen the benefits of having Medicaid when they were children pay for their life-saving surgeries, or helping them to deliver a child and now have a healthy baby. So reading these stories, sharing your own, is a way to really engage with some of the human impact of this program. And there's also a link to very easily text your elected officials and let them know that you support these policies and need their representation in Congress to come up with reasonable and pragmatic solutions. You can text Majority to 50409 to send a policy letter to your representatives expressing concern and raising awareness about these issues.
Yeah.
And I'll just add,
I've already done that, and my two Democratic senators probably were on board anyway. But thanks to states. Sorry, Marianna.
oh no, I didn't mean to cut in. I was just saying, I also I shared my own story first of all, and I think that that's also an important piece of this campaign is sharing stories for those who were on Medicaid at some point in their life or still are, and how that's really important, as Stephanie said. So that's one. Two, texting was super easy. I just wanted to mention that. I was thrilled to receive responses back from my representatives. Even though, again, Matt, I think, yes, Democratic representatives, probably obvious that they were going to respond well. And then the other thing is it was Medicaid's 60th anniversary just a couple of days ago on July 30th. So there is a campaign around the anniversary as well. So it's a big milestone.
Yeah, my idea that it should be abolished is not quite what you think I'm saying. But if we're going to have a separate program that's an aid program, whoops, I'm smashing stuff up here. It's an aid program rather than a care program. Let's think about doing it sensibly. I'm not sure that's possible in the current way we do it, but we can certainly do it better. So that's fantastic. But I think it's great that, again, you guys are taking, and particularly you, Stephanie, taking time out from the hell that is running a startup every day to actually think about these wider issues. I'm very proud of you for doing that, and very happy to support. So that is your update on Boulder Care. We're speaking with relatively new head of partnerships, Marianna Zaslavsky. God, Marianna, I will have to screw up your name a few more times before I get it right. And Stephanie Strong, the CEO. Both of you, thanks for coming on THCB.
Thank you so much, Matthew. Great to see you.
Thank you so much. Great to meet you.